This is the STL Medical Weight Loss Radio Show with Dr. Joe. No more talking, let's go.
Welcome back to the STL Medical Weight Loss Radio Show. I'm your host, Dr. Joseph Moleski. I'm here with my friend Drew in studio today, and I'm just excited to be discussing the results. We were discussing the pinch of the needle versus losing 40 pounds.
Yes.
And we decided that the 40 pound, losing that is better than just...
I think it's worth it.
Yes, it's worth it. Yes, I'd agree. So we talked about common myths. We talked about a lot of things. But I wanted to get into, I had a dinner with one of my buddies, and he had a friend come. Okay. It was actually his uncle. Okay. And one of the things that we discussed was, my medical weight loss practice and what I'm doing. And so right when we sat down at dinner, he goes, "You're a doctor?" I said, "Yep." He goes, "Can you look at my labs?"
Oh my gosh.
So
on the spot.
On the spot. I said, "You know what? I'm ready to look at the labs." So he pulled it up. It was LabCorp. So I'm looking through, and he's drinking, a sugary beverage, and he's eating chips. And I'm looking at these labs. I'm thinking, man, I gotta break the news.
Right.
So,
FYI.
Yeah. So he said, I've got some weight around my midsection, and he said, I want to lose about, 30 to 40 pounds, and I got this pain in my thumb, and sometimes my toe hurts, and I just need to know what's going on with me. And so first thing I asked was, what's your blood pressure? He said, my blood pressure runs high. My blood pressure is 140/90. I have a little bit of cholesterol issues, and I think I got something called gout. So I started, I grabbed his phone, he pulled up the LabCorp labs, and I just started browsing through just his basic labs. So his CBC, CMP, some of the basic labs you would get. And looking at his liver function, that's the first thing I noticed. So, and we run all these tests. If you decide to book an appointment, if you've had labs recently, we don't. You can just send them to us. But if it's been a year, we can run them for you. Just let us know.
Right.
But when I was looking at his liver function, it showed his triglycerides were elevated at 164. And the reason I look at that is because what would you talk about? The liver, the gut. So if your liver is somewhat inflamed, or you have the early stages of like fatty liver, you can develop what we call hypertriglyceridemia, which is elevated triglycerides. So the marker that I see that with patients that they start developing that is when their triglycerides go above 150.
Okay.
And then I started looking at what his blood sugars are. So his fasting blood sugar was 106.
Oh, wow.
So over 100 is prediabetes. So the final thing I looked at was, he said he had gout. His uric acid was about 6.8. So all those indicators.
Yeah, red flag.
Yes. So what I can tell you right now, a guy comes to me, wants to lose weight. He's got, a little bit of fat around his abdomen. That tells me insulin resistance. I've talked about that on the show. Next thing, his liver. I can see it right now. He's got some liver fat.
Sure.
Then he has prediabetes, and he's got high blood pressure. What is that? Metabolic syndrome. So it's a constellation of increased, weight, high blood pressure, abnormal cholesterol readings, whatnot. So this guy, he fits that 1 in 4, 1 in 3 of Americans have metabolic syndrome.
Exactly.
So that's why I got into this. I got into this because I've seen what years of dysfunctional blood sugar, metabolic syndrome, and obesity can cause when somebody's in their 60s, 70 years old, and they've been living with this condition that's affecting most of us actually. And it ends up in a heart attack or stroke.
In fact, I don't think people are in tune to have this information, sadly. They just go on about their day, and I know life's busy and so on and so forth, but if you're not in tune to your health, you're not going to be living.
Correct.
Sorry.
Yep.
So I love how you use the tagline, invest in you. You better invest in you, not just, not this program, but just your blood work, your health knowledge. That's so important. You're
in the driver's seat of your health. And what I always say is, I've been the patient. I have a severe bleeding disorder. I've been that patient that doesn't know what's going on. And I remember when I first started doing hospital medicine, I'm admitting people with sick. They're very sick. They have heart attacks, strokes, whatever it may be, limb amputations. I'm admitting these sick patients.
Right, and you've seen it all.
I've seen it all. And my thing of it is like, when I was like, wait a minute, I remember being in a hospital bed. So when a doctor came in, I wanted them to like sit down and explain to me what was going on. I didn't want to say, here, med, bye. I mean, you feel alone.
You know, you're right, and I mentioned that in one of my live reads for you this past week on the morning show is you genuinely care for your patients. I know most doctors or all doctors, that should be the number one thing, right? Mm-hmm. But you know, they're also, I don't want to say in it for the wrong reasons, but hey, it's, okay, here, I've seen you, here's a med, good luck, see you in 3 months, see you in a year.
Yeah.
Where you can relate to being the patient.
Yep. And
then you use that experience, that passion, that purpose, and you've lit a whole world here on fire with this weight loss program. I think it's fantastic.
Yeah, and it focuses in on, and I appreciate that, it focuses in on prevention. And that's what I want is I want to see, you know, if I'm able to intervene in somebody's life in their 30s, like, you know.
I'm 34.
Yeah, and I'm 35. And I think that if I see you in the next 10 years and I'm like, wow, I probably, most definitely, made your life longer.
I'll say it right now, I guarantee you did.
Yeah.
Because if I just kept living the life, I was at 380 pounds, man. Like, I don't even, when I look in the mirror, I don't even believe it. I mean, but it's all in the gut. Like, I carry myself really well.
Yes.
But it's just in the gut for me. And had I not started this program to learn this education with the program and the intentions on the outside of the program, I could be dead in 10 years.
Yeah. And I've had a few patients, men, that reached out to me like, hey, I just want to let you know, my dad just got diagnosed with heart failure. And I'm, you know, in my 40s, I need to get a handle on my health. I need to do this now. And I just tell them like, hey, first of all, you made the right decision to even just pick up the phone. Number two, I'm happy that you're deciding to want to change for your kids, for your friends, for whoever it may be. It could be your dog or your best friend.
Absolutely.
But you are recognizing that you don't want to end up like your dad and you want to change. And I think I applaud these people that say, hey, you know, you see what's on the TV, you hear all these opinions about medications or whatnot, but you want to do something for yourself. You want to make sure that obviously things are safe and the medication fits for you, but you don't want to be a statistic. You don't want to be, oh, yeah, 1 in 3 Americans have prediabetes and then it'll develop into diabetes and then you'll get, you know, heart failure, heart attack. No, like I want to let everybody that's listening to this, you have a choice. And I can tell you this, I love saying this, but why don't we make chronic disease optional? Why don't we make heart disease, diabetes, hypertension optional? Because I can tell you, you know, you just told me your weight. If you let that go, you would have developed one of those chronic issues.
I know I would have.
You would have developed
it. We said it last week on the show. I know my why.
Yep.
Do you? You know, I have a 16-month-old baby girl. I want to be around when she's 10, 20, 30. I want to walk her down the aisle when she gets married, so on and so forth. If I stay on this, you know, path that I was on, that's not guaranteed. And I don't know what's going to happen tomorrow. I mean, who knows? The Lord upstairs has that answer, right?
I agree.
But at least my mindset's not going to be now, oh, it's not going to happen to me. I'm fine. I'm now in control.
Correct. Yep. And I love that. I mean, you know, seeing, you know, earlier and earlier stroke patients at the hospital. I brought this up on one of the shows, I'll bring it up again, is I asked the neurologist, and he sees, you know, 10, 12 strokes a day. And I just said, hey, you know, why are we seeing patients in their early 40s and early 50s with strokes? He goes, Joe, it's the diet. It's the diet.
Wow.
It's the diet. And, you know, pretty much after a patient gets a stroke, they put them on stroke preventative medicines like aspirin and Plavix, and they put you on a cholesterol medicine. But that's called secondary stroke prevention. But you've already had the stroke. The damage is there. They can't go in and reverse dead neuronal tissue. No. Like, if you end up having a stroke, like, it's physical therapy, it's secondary stroke prevention, preventing future strokes. And then people then, you know, get the message, oh man, if I don't straighten up and I don't change, I could get another stroke or something worse. And so that's why I got into this, is like, you know, it starts with your health. If I can intervene in patients' lives, like in their 30s and 40s, even in their 50s, I could prevent an adverse outcome and prevent future hospitalizations. And that's why I'm so passionate about this.
I'll go younger. I know people that have had heart attacks in their 20s.
Yeah.
It's not uncommon. You don't hear about it every day, but for these people that are having strokes in their 30s and heart attacks in their 20s and their health's not right, that's a huge wake-up call.
It is.
So I've had my awakening, and if you are having yours, it's so easy to get involved here with Dr. Joe.
Yeah. It's simple. You are, like Drew said earlier, it's all telemedicine based. You're able to, speak with one of our team members. You're able to get the medication shipped pretty quick to your door, 7 to 10 days, business days.
Not even that. That's a guideline.
Yep, that's a guideline.
They usually beat it.
Yes. And then, you have that, that constant, well, I'll call it, you're part of our family or a friend. If you have questions, we're always here to help. And no question, I want to let everybody know this, no question here is a stupid question. I get patients will ask, hey, like, if I inject it here, or do I need to do it in the morning? Do I need to do it at night? Any question is fair game, and we're here to be your friend and help you through this process. That's what we're here for. We want to see you change, but we also want to walk the journey to better health together with you to make sure that we're both successful in this journey.
Maybe a dumb question, but I know it's a question that people have asked me personally. And I think it's maybe case by case basis, but insurance doesn't cover a lot of this.
Correct.
It is out of pocket,
Correct.
But there are some payment options you could do
payment plans,
and work with people. So don't think when you go to the website and say, oh my gosh, and this is best pricing, by the way, too, when you go to your website.
Sure.
If you were to go and just get this anywhere else, you could be spending double.
Yeah, and one of the things I will bring up briefly, we're at the end of the segment, but one of the things that we do is, we have the name brand medications. Mm-hmm. Those are anywhere between, even with GoodRx, it's about $900 to $1,300 per month.
That's
so. Wow. What I've done is I decided, hey, I want to provide a solution. I don't want patients to not be able to get this medicine based on price. So I get all my medicines compounded with a B vitamin. It helps with nausea. You're able to there's no dosage shortages. You're able to get your medicine on time. So everything's compounded, and the price is about half.
Exactly.
It's about half. And, how we do it is we can do 90-day scripts. We actually take some money off if you do a 90-day. And then we have payment plans. So if you're like, yeah, I want to do it, but I don't have the money, well, what we can do is set up a payment plan, and we can make that a reasonable price for you, and we can spread that out over 90 to 120 days. So we have that option, because I don't want price to be the reason that you're not going to do this, and you're going to keep living unhappy, not confident, and then in the future you're going to develop a heart attack, stroke, or whatever it may be. I'm here, my team's here to make sure that we can do whatever it is to make sure this is affordable and we're able to help you.
The investment is 100% worth it.
Yep, I totally agree. And the thing that I would say is, hey guys, everyone that's listening, if you're tired of not having confidence, being inundated with all the stuff in the media or even online of what you should do for your diet, what you shouldn't do, what you should do, I would say what you need to do is decide that you're going to invest in yourself and make feeling terrible every day and just tired of being sick and tired. What you need to do is invest in yourself. So book a call, book an appointment, stlmedweightloss.com, or book a call at 636-628-6604. We're always happy to help.